Good morning, everyone. We'll get started now. It looks like everyone may be here. Welcome to the April 19th, 2023 Legislation and Regulation Committee meeting. My name is Jessie Crowley, chairperson of the committee. Before we convene, I would like to remind everyone present that the board is a consumer protection agency charged with administering and enforcing pharmacy law. Where protection of the public is inconsistent with other interests sought to be promoted, the protection of the public shall be paramount. This meeting is being conducted consistent with provisions of Government Code Section 11133. Participants watching the webcast will only be able to observe the meeting. Anyone interested in participating in the meeting must join the WebEx meeting. Information and instructions are posted on our website. As I facilitate this meeting, I will announce when we are accepting public comment. I've advised the meeting moderator to allot 3 minutes to each individual providing comments. This approach is necessary to facilitate this meeting. Before we get started, I would like to ask staff moderating the meeting to provide general instructions.
This is the moderator. When the committee opens up for public comment, I will open the Q&A and I will demonstrate at this time. I will open the Q&A, which will open a Q&A box at the bottom right corner, or if you can't see it, don't have access to it, just click on the question mark inside of the square, which is typically at the bottom right corner of your WebEx screen. And in the text field that appears, you type in the word comment. Before you click that send button, make sure it goes to all panelists or that it asks all panelists. And then you click send. You can also raise your hand by opening the panelist list, which is also bottom right corner of your WebEx screen and looks like the outline of a head and shoulders with 3 lines on it, on one of its shoulders. You click on that, the name of panelists will appear. Your name will appear under the attendees. Hover the cursor mouse over your name and the outline of a hand will appear. Make sure you click on that outline of the hand for it to raise your hand. So those are for those that are logged in. If you are calling in or plan to call in, press *3 from your phone to raise your virtual hand. And once you've been called on, just click the unmute me button that appears on your screen or respond to the prompt that you get on your phone. So I will turn it back to the chair.
Thank you. I would like to now take a roll call to establish a quorum. Jose de la Paz.
Present.
Thank you. Trevor Chandler.
Here.
Thank you. KK Ja.
Present.
Thank you. Maria Serpa.
Hi, licensee member present.
Thank you. And Nicole Tebow.
Licensee member present.
Thank you, and I'm here. A quorum has been established. Members, we will have a full agenda for our meeting today. I ask everyone participating today to be respectful of the work before the committee. We encourage participation by members of the public throughout our meetings at appropriate times. The committee respectfully requests that when comments are provided, they are done so in a professional manner consistent with how the committee conducts its business. Agenda item 2, public comment for items not on the agenda. I will now ask the moderator to open the line for individuals to provide the opportunity to provide public comment. You are not required to identify yourself, but you may do so. As we open the lines, I would like to remind everyone that the board cannot take action on these items except to decide whether to place an item on a future agenda. Members, following the review of the public comments for this agenda, I will ask members to comment on what, if any, items should be placed on a future agenda. As a reminder, this agenda item is not intended to be a discussion, rather an opportunity for members of the committee and members of the public to request consideration of an item for future placement on an agenda, at which time discussion may occur.
This is the moderator. The instructions are on the screen for your reference. If you would like to participate in public comments, click on the question mark inside of the square, bottom right corner of your WebEx screen, and type comment in the text field that appears, and make sure it goes to all panelists before you click the send button. If you're calling in, press star 3 to raise your virtual hand. I do have individual identified as Stephen Gray who would like to make a comment. Stephen, I'm going to send a request to unmute your microphone, and I will provide a 10-second warning before your 3 minutes are up. And Stephen, I've sent a request to unmute your microphone.
Like to suggest that there be another meeting scheduled of this committee soon. There are several other bills that are coming into play regarding pharmacy practice. And so hopefully this committee will have a chance to consider all of those before action is taken by the legislature. And it's very important. Thank you very much.
This is the moderator. No further requests have been submitted. Would you like me to close the Q&A feature?
Yes, please. Members having received public comment, I will now open the discussion up to ask members if they would like to include this item on a future agenda, or I'm not sure if I should defer to Anne to see if another meeting is necessary or realistic from the staff perspective. Seeing
This is
none.
Ann. I didn't want to interrupt, just the members wanted to chime in, but I'm happy to work with the chair offline and we can make a determination if that's appropriate.
Great, thank you. Agenda item 3, approval of the July 18th, 2022 committee meeting minutes. Members, including in the meeting materials is draft minutes from our July 18th, 2022 committee meeting. As we begin, I will ask if members have questions or comments on the draft minutes from that meeting. I would also entertain a motion if you believe such action is appropriate.
I move to approve the minutes.
Thank you.
I second it.
Thank you. So with a motion and a second on the floor, I will now open the discussion for public comment on the July 18th, 2022 draft minutes.
This is the moderator. The instructions are on the screen for your reference. If you would like to participate, click that question mark, type comments, send to all panelists, or press star 3 from your phone to raise your hand. No requests. Would you like me to close the Q&A feature?
Yes, please. So agenda item 4, discussion. Oh, sorry, we have to take a vote. With a motion and a second, public comment received, I will now take a roll call vote. Jose de la Paz.
Yes.
Thank you. Trevor Chandler.
Yes.
Thank you. KK Ja.
Yes.
Thank you. Maria Serpa.
Yes.
Thank you. Nicole Tebow.
Yes.
Thank you. And I vote yes, the motion passes. Moving on to agenda item 4, discussion and consideration of pending legislation impacting the practice of pharmacy, the board's jurisdiction, or board operations. Members, as indicated in the meeting materials, there are 16 measures for our consideration, which include 2 board-sponsored bills. As legislation is very dynamic, there have been changes to some measures since the release of the meeting materials. In general, I do not plan to extensively read the information contained in the meeting materials. However, where changes have been identified, I will highlight them for members. I also note that staff have offered recommendations on several measures. Should you agree with the recommendation or believe another position is appropriate, I would welcome motions as part of your comments on each measure. The recommendations we vote on today will be considered by the board tomorrow. So moving on to number 1, Assembly Bill 317, Weber pharmacist coverage, pharmacist service coverage. Members, Assembly Bill 317 would require a healthcare service plan and specify disability insurers that offer coverage for a service that is within the scope of practice of a pharmacist to pay or reimburse the cost of services performed by a pharmacy at an in-network or out-of-network pharmacy as specified. As the meeting materials note, the licensing committee has received public comment from pharmacists detailing barriers to patient care stemming from a lack of reimbursement. The measure is sponsored by the California Pharmacists Association and National Community Pharmacists Association. I agree with the staff recommendation to establish a support position. Members, I would appreciate your comments on Assembly Bill 317 and would entertain a motion if you believe such action is appropriate.
Is Jose de la Paz motion to support?
Thank you.
Second.
Thank you. And let's see. Thank you. And moderator, can you please open for public comment on Assembly Bill 317?
This is the moderator. The Q&A is now open. The instructions are on the screen. If you would like to participate, click that question mark, type comment, and send it to all panelists. Or if you're calling in, press *3 from your phone to raise your virtual hand. I do have a couple requests here. First, from Keith Yoshizuka. I apologize if I mispronounced your name. I'm going to send a request to unmute your microphone. And you're unmuted.
This is Keith Yoshizuka, California Society of Health System Pharmacists. We speak in support of Assembly Bill 317. We would, however, like to see it expanded because it is restricted to reimbursing pharmacies, which excludes essentially all of the ambulatory care pharmacists who provide these services. We would like to see it for pharmacists as opposed to pharmacies, because in many of these instances, the care is provided not in a licensed pharmacy, but in a medical clinic. Thank you very much.
Thank you for your comment.
Next individual, Stephen Gray. I'm going to send a request to unmute your microphone.
Thank you very much. Can you hear me?
Yes.
I would echo strongly what was just presented by CSHP, and to add to that, there are literally thousands of pharmacists who do not work in a pharmacy or a hospital. They work in ambulatory care situations, including under federal law, they work in medical offices incident to physician services. The way this is worded, it would say that they would only be required to pay for a pharmacist's services if they worked in a pharmacy. And so I recommend that you change your motion to support if amended. This is very important. You know, it's if you really look at it, it is not the pharmacy that provides clinical services. It is pharmacists that provide clinical services. But in many situations, the pharmacist has a contractual relationship with the pharmacy, and that can be worked out. So the best result would be to change the language so it said pharmacy or pharmacist had providing these services, and it could be worked out between the pharmacy and the pharmacist, whether they're an employee, whether they're a subcontractor or whatever. So please change your motion to support if amended. This is super important. Thank you.
This is the moderator. Next individual, Lindsay Gullahorn. I'm going to send a request to unmute your microphone.
Good morning. This is Lindsay Gullahorn with the California Community Pharmacy Coalition. I just want to note that we are in support of this bill. Thanks.
This is the moderator. Next individual identified as M. Rivas. I'm going to send a request to unmute your microphone.
Pharmacists Association, sponsor of AB 317. I want to thank the staff for their recommendation of a support, and we are also making the request that the board support the legislation. We know that we've granted pharmacists a number of authorities over the past several years, and the whole purpose is to increase access to care, which is not going to happen unless pharmacists are reimbursed by the health plans for doing so. So again, we appreciate the staff's recommendation and urge your support. Thank you.
This is the moderator. No further requests have been submitted. Would you like me to close the Q&A feature?
Yes, please. With the motion on the floor and public comments received, are there any additional comments from members?
Uh,
Sorry, I can't see hand raised, so please feel free to speak up.
Oh, got it. Thank you. Yes, I really appreciate the feedback here and from the public. And what I would recommend us doing is voting down this motion and then having a second motion of support if amended to include both pharmacies and pharmacists in the legislation. So I will vote no on this motion in the hopes that we can make another motion to support or amend a support if amended on this bill.
This is Jose De La Paz. I think we could also, well, I could also entertain a friendly amendment to the motion.
Okay.
And then we could provide, the language that you feel is appropriate, and then we could adopt that as the motion.
Great. Yeah, I'd like to make a friendly amendment that we support if amended to include pharmacists alongside pharmacies in the legislative language.
Okay, this is Maria. I think the attorneys will speak up about the friendly amendment because that's typically not approved to do that way. But I would speak in support of continuing the motion as a support. While I agree with the concept, I'm a pharmacist and know many pharmacists that practice in this area. I believe it's the role of the board to advocate for what our role is, and that the sponsor, CPHA, hearing this information, should be moving forward on advocating for pharmacists. Our role really is not to advocate for pharmacists, but to advocate for patients. And many times those two are the same. So I just would be concerned that as the State Board of Pharmacy, that we go into this area of requesting an amendment of something that is really that's required of pharmacy organizations that support the profession.
Yeah, I support it. Yeah, I support it as is. I second what Ms. Serpa just said. I'm okay to discuss it further, but I'm okay with as is.
Okay. Do any other members have any comments on it? Okay, I do agree. I think it would be better to be inclusive. However, maybe because we're a little mixed, what we'll do is a vote on the original motion. So we'll be voting on the original just support. So if we have enough people who vote that down, then we can always do an amendment and go from there. So with the motion and floor second, public comment received, I'll go through roll call vote. Jose De La Paz.
Yes.
Thank you. Trevor Chandler.
No.
Thank you. KK Ja.
Yes.
Thank you. Maria Serpa.
Yes.
Thank you. Nicole Tebow.
Yes.
Thank you. And I vote yes, the motion passes. Moving on to the next Assembly Bill, we have Assembly Bill 602, California State Board of Pharmacy Emergency Refills Report. Members, the next measure for our consideration is Assembly Bill 602. The measure was heard in committee on April 18th, and the measure passed through committee as a consent item. The measure would require the board to report to the legislature on or before February 28th, 2025, the total number of times a pharmacist refilled a prescription for a dangerous drug without a prescriber's authorization. Further, it would require the board to report the total number of complaints the board receives alleging that a pharmacist failed to refill a prescription because the prescriber was unavailable, and would require the board to make a reasonable effort to determine how many of these complaints resulted from the pharmacist's failure to refill a prescription due to a lack of understanding of the authority vested in pharmacists to refill the prescription. I note some of the implementation challenges identified by staff. I agree with the recommendation to establish a watch position and believe it is appropriate for staff to provide technical feedback to the author's office. Member, please open the lines for public comment. Oh, actually, sorry, we think we need to have a motion on the floor potentially.
Hi, yeah, this is Nicole. I just wanted to say I agree with staff. I don't know how we would do this. Like thinking of a pharmacy and our computer systems, there wouldn't be a good way to identify because sometimes pharmacists are prescribing under protocols and other authorities. So I don't really know how you would tell the difference. So I agree with the board position, the staff position to watch, and I will make a motion that we take a watch position.
Perfect, thank you. Any additional comments or a second on the motion?
I would like to comment that enforcement of this will be a very tricky with the hundreds, if not many more operating systems that are out there and protocols under which pharmacists practice. I would like it to be watch as well, or a little more refinement in if possible, so it can be enforceable.
Great, did you want to make the second to the motion, KK?
Second to the motion to watch, right? Yes.
Yeah.
Yes, I would second it.
Thank you. Any additional member comments? Okay. Hearing none, moderator, please open the lines for public comment.
This is the moderator. The Q&A is now open. The instructions are on the screen for your reference. If you would like to participate, click that question mark, typically bottom right corner of your WebEx screen. Type comment in the text field that appears and make sure it goes to all panelists before you click that send button. If you are calling in, you can raise your virtual hand by pressing *3 from your phone. No requests have been submitted. Would you like me to close the Q&A feature?
Yes, please. With a motion on the floor and no public comment received, unless members have additional comments, I will take a roll call vote. Jose de la Paz,
It helps if I unmute myself, yes.
thank you. Trevor Chandler,
Yes.
thank you. KK Ja,
Yes.
thank you. Maria Serpa,
Yes.
thank you. Nicole Tebow,
Yes.
thank you. And I vote yes, the motion passes. Members, Assembly Bill 663 would allow a mobile unit deployed as an extension of a county-owned pharmacy to carry controlled substances approved by the FDA for treatment of opioid use disorder under specified conditions. This measure follows up on last year's provisions, which created the initial authority of the use of a mobile unit as an extension of a county-owned pharmacy. I agree with the staff recommendation to support the measure and note the significant support already on file for this measure. Members, I will welcome your comments and would entertain a motion if you believe such action is appropriate.
I move to support.
Great, thank you.
I'll second that.
Great, thank you. Moderator, can you please open the lines for public comment?
This is the moderator. The Q&A is now open. The instructions are on the screen. If you would like to participate, click that question mark, type comment, send it to all panelists, or press *3 from your phone to raise your virtual hand. I do see individual identified as Keith Yokizuka. I apologize there. I'm going to send a request to unmute your microphone.
Keith Yoshizuka, California Society of Health System Pharmacists. We speak in support of Assembly Bill 663. Thank you.
This is the moderator. No further requests. Would you like me to close the Q&A feature?
Yes, please. With a motion on the floor and public comment received, unless members have any additional comments, I'll take a roll call vote. Jose de la Paz,
Yes.
thank you. Trevor Chandler,
Yes.
thank you. KK Ja,
Yes.
thank you. Maria Serpa,
Yes.
thank you. Nicole Tebow,
Yes.
Thank you, and I vote yes, the motion passes. Members, Assembly Bill 913 would require the board to license and regulate pharmacy benefits managers as specified. This would require the board to promulgate necessary regulations and prepare a report to the legislature on or before August 1st, 2025, and annually thereafter. I agree with the comments from staff that implementation of this measure would be a significant undertaking, but has the potential to address significant patient care challenges that currently exist. The measure would also address inequities that currently exist in pharmacy reimbursement models. Board staff has advised that this measure has become a 2-year bill. As such, I believe discussion is premature. I suggest staff monitor for updates and bring the measure back to committee when appropriate. Members, I welcome your comments.
Yes, hi Jesse, this is Nicole. I wanted to mention here that we got a comment that perhaps the authors would like to include reference to the 340B program in this. So just wanted to point that out to the authors, that would probably be really important to specify in this bill going forward. I do agree with you that this is a long bill, and I would be fine with making a motion to watch, but just wanted to make sure I commented on the comment that we received.
Perfect, thank you. Yeah, I think that's an important comment that we did receive. I don't think a motion is necessary since it's been extended. Am I correct in my understanding, Anne?
It is a 2-year bill, so board staff can continue to watch, but if the board would like to establish a formal position, welcome to do so.
Okay, thank you.
I'm overzealous this morning, so we do not have to take a position.
Thank you. Any other comments?
This is Maria. I would feel comfortable having a formal watch position. It puts us on the radar with the author's office and makes it a little bit more formal, especially since it's impacting pharmacy practice. I think we had a previous watch position on another one, so it's not unprecedented. So I would feel comfortable with a watch position, but would defer to the chair should you would like it just be monitored.
Yeah, I'm okay with that. Nicole, if you want to create a formal motion of watch and maybe Maria second, then I would be open to that.
Sure, I'll go ahead and I'll be the formal motion to watch.
Great, thank you.
Thank you. I'll go ahead and second.
Thank you. With a motion and a second on the floor, moderator, can you please open the lines for public comment?
Yes, this is the moderator. The Q&A is now open. The instructions are on the screen for your reference. Members of the public, if you would like to participate, click the question mark inside of the square, type comments, send to all panelists, or if you're calling in, you can raise your virtual hand by pressing *3 from your phone. I do have individual identified as M. Rivas. I'm going to send a request to unmute your microphone. Request has been sent.
Good morning, Michelle Rivas, California Pharmacists Association. Thank you for bringing this issue forward. We are respectfully requesting that the board take a support position on the legislation. I understand with the bill being made a 2-year bill, some hesitancy maybe in doing so and recommending a watch position, but I think for our purposes, for advocating the need to finally have some regulation and oversight and transparency in a space I think we can all recognize has really become quite problematic in the practice of pharmacy, for us to be able to use the fact that the board recognizes that this is an issue would be very helpful in our arguments moving the bill forward. And I also want to stress that the bill being made a 2-year bill is really to give us the opportunity to continue to work on language and make it a stronger piece of legislation. So again, having the board support, at least in concept, of the fact that the PBM should be regulated and that the Board of Pharmacy as patient is your responsibility as protectors of the patients, not pharmacists, and pharmacies would be very helpful in our efforts. So again, we respectfully request that the board support the legislation. And of course, we would work very closely with staff as we continue to work on the language. Thank you for your consideration.
Thank you for your comments.
This is the moderator. I have Sandra Gukyan. I apologize if I mispronounce your last name. I'm going to send a request to mute your microphone. And Sandra, I'm going to send another request to mute your microphone. Just make sure from your end you click the unmute me prompt that will appear on your computer or device. Unmuted.
Hi, this is Sandra Guckian with the National Association of Chain Drugstores. NACDS is also in support of AB 913, and we would also encourage the board to take a position today of support on this legislation. Thank you.
This is the moderator. No further requests. Would you like me to close the Q&A feature?
Yes, please. Members, having received public comment, are there any additional discussion or thoughts?
Hi, Jesse. This is Nicole. I actually, in listening to the public comment, think we should take a support position. So if that means we have to vote no on the watch and then re-vote, I do think we should, because this really is a huge issue for public safety, which is our goal and our mission. And I think that it has, even though we might want to see more of the details, I think the premise is very much in line with our mission. So that's my thoughts.
Great, thank you, Nicole. I think I agree with you too, especially if this is going to help push the bill forward. Oh, sorry.
Maria, sorry, I didn't know if you saw my hand.
No, I'm sorry, I can't see hands.
Okay, so I'm sorry I interrupted you, but I would continue with the watch position. Politically, in the legislative process, you know, we certainly don't want to support something that could change to something that we would have to change to support if amended, or even potentially something that is problematic in the future. It's just not a good strategy to do that you could in dealing with the author's office and other stakeholders. So I would prefer to be a little bit more conservative, put it as watch, showing our interest, and then of course we can always move to support as the information is fleshed out. My concern is that there are changes pending on this, and that we could get caught with a support position on something that is not something that we totally support.
Great, thank you for your comments, Maria. Any other comments from members? Okay, so we'll do a roll call vote on the original motion, which is to establish a watch position. Jose de la Paz?
No.
Thank you. Trevor Chandler?
Yes.
Thank you. KK Jha?
Yes.
Thank you. Maria Serpa?
Yes.
Thank you. Nicole Tebow?
No.
Thank you. I vote no. Okay, we have a tie vote. Anne, can you provide me on some guidance on how we move forward so that doesn't pass? Is that correct?
This is Eileen Smiley. Yes, if you have a tie vote, it doesn't pass. So
okay.
If you're going to have a tie vote on the other way, then you may not have a position. So I don't know if you want to entertain a different motion.
Yeah, okay. So I guess for anyone want to entertain a different motion?
This is Nicole. I'll go ahead with the motion I had proposed before, that we take a support position.
Perfect. Thank you, Nicole. Is there a second?
I will second that.
Perfect.
I have a comment.
Oh yeah, go ahead, Maria.
I think if you heard what Eileen's comment was, that if this fails, we do need a third motion. Otherwise, we'll have no position, which is worse than anything. So I think we all agree we need a position. It's just, what is that position?
Agreed. Okay, so we'll do a roll call vote on a support position. Jose de la Paz? Oh, sorry.
I'm sorry, but we should open it up to public comment because we've changed the motion.
Thank you, Eileen. We'll open it up for public comment.
This is the moderator. The Q&A is now open. The instructions are on the screen for your reference. If you would like to participate, click the question mark inside a square, type comment, and send it to all panelists. Or if you're calling in, you can raise your hand by pressing *3 from your phone to raise your virtual hand. We do have a few requests here. I'm trying to go in order. And Suzanne Bonilla, I'm going to send a request to unmute your microphone.
Yeah, CEO with the California Pharmacists Association, and we are co-sponsors with this bill. And I just wanted to encourage the board. This is an active bill just because it is not going to probably be moved until January. The reason for that is because we are working with so many departments, including the Board of Pharmacy. We're working with Department of Insurance, Department of Justice, Department of Managed Healthcare, and also the board. So my suggestion might be whether it's a support or watch, that maybe part of the effort can be to direct staff to be actively involved in the design as we move forward of this bill. We would really appreciate having the Board of Pharmacy's input. That's very important on this critical issue around transparency with the PBMs. And there's a very important role for the Board of Pharmacy to play. So hopefully there will be active engagement and that kind of support certainly from the board as we continue to work on the details of the bill. Thank you.
The moderator, I'm going to send a request to unmute Stephen Gray's microphone. And Stephen Gray, I'm going to send another request to unmute your microphone.
I now it just popped up. Can you hear me?
Yes.
Okay. I think Maria Serpa makes a very good point. This is a very complicated bill. It will involve a lot of stakeholders that are very interested, strongly feelings both ways. I think sending a message at this time would be best to say watch. There are, as she indicated, there are considerable changes probably to be made if it is going to move forward over the next 2 years. So I would suggest strongly that you maintain a watch support rather than a support at this position. Thank you.
This is the moderator. Next individual identified as M. Rivas. I'm going to send a request to mute your microphone. And after that, it's Rita Maria. So M. Rivas, give me just a moment to send a request.
Hello again, Michelle Rivas, California Pharmacists Association. Again, we would urge the board to support the legislation in its current form. And again, while I certainly do understand the reservations of some of the committee members to keep it a watch position, because yes, the legislation will change, it's also appropriate for the board to support the legislation and note that it's supported in its current form. So in the unlikely event that the bill is amended to add language that may not be agreeable to the Board of Pharmacy, you would be on record as supporting the legislation in its current form. And again, in order to give us a stronger position in our negotiations, having the board on record that you support the regulation and oversight of such a huge player in pharmacy would be incredibly helpful to all of our efforts. Thank you. Appreciate your consideration.
This is the moderator. And I'm going to send a request to unmute Rita Maria's Alajan, and I apologize if I mispronounced your last name there. A request has been sent.
My name is Rita Maria. I'm from Cedars-Sinai. We do have a support if amended stance on this bill, and thank you to board member Nicole for acknowledging the comments we submitted to the board. in regards to including 340B pharmacies within the bill. We do think that the bill requires a little bit of work. And in addition to that, also the language in the bill is unclear as to what the PBMs will do with the retained 20%, or why specifically the language just stays 20%. Other bills in other states have 100%. And so we want to obtain some additional clarification on some of the sections within the bill, in addition to the written comments we provided. Thank you.
This is the moderator. No further requests. Would you like me to close the Q&A feature?
Yes, please. Thank you. So with public comment received, I'll do another roll call vote. Jose De La Paz.
Yes.
Thank you. Trevor Chandler.
Yes.
Thank you. KK Jha.
Yes.
Thank you. Maria Serpa.
No.
Thank you. Nicole Tebow.
Yes.
Thank you. And I vote yes, the motion passes. Okay, moving on to the next bill. Members, Assembly Bill 1060 would make legislative findings regarding the naloxone hydrochloride as a medicine that can counter overdose effects when administered timely to reduce opioid overdose deaths. The measure would prohibit healthcare service plans, insurance plans, and Medi-Cal from imposing a cost-sharing requirement, including a copayment or deductible for coverage provided, and shall require the plan to cover the costs of prescription or non-prescription naloxone hydrochloride. I agree with staff recommendation to establish a support position. While the FDA has recently approved the purchase of naloxone over the counter, there is a lot of unknown as to what the cost will be and what insurance will decide should someone get the medication as a prescription. Members, I welcome your thoughts and would entertain a motion if you believe it's appropriate.
I want to speak out fully in support of this bill. One issue I would love to raise and get feedback from the committee is, I know we recently approved regulatory changes limiting regulatory language from just naloxone to making it opioid antagonist, to make it a much broader definition, so new things that come onto the market are covered by as well and whatnot. So I'm wondering if, obviously, fully in support, we need to make naloxone and opioid antagonists as easy and accessible to get as possible at minimal cost to fight against this horrific overdose crisis. And what I'm wondering is if we should push the co-sponsors and provide a recommendation to follow this new language that we already approved and say just doing naloxone as a brand isn't enough, and that this should actually cover all opioid antagonists that eventually come on the market. And so I wanted to put that out there as a thought to see what other people think, but obviously fully in support of this bill and anything that goes to help fight the opioid epidemic.
Great, thank you, Trevor. I think that's a really good call out, actually. I think we can probably all agree that at least naloxone is a good starting point, but I'm curious to see what other members think too.
Hi, Jesse. This is Nicole. I agree with Trevor that ideally it would say both. However, I would not want that to stop us from taking a support position. I wouldn't even say support if amended, because I think this is so important that it goes through. So I think that would be a suggestion we can make to the authors, but that I would still go ahead with a support position to make sure that this that we show that we believe this is really important for public safety.
Yeah, I generally support this. However, I would like it to be discussed on a drug by drug basis, knowing every drug can have a different parameters that we need to consider. So, but as it stands today with naloxone, I fully support it.
Great, thank you. Does anyone want to make a motion?
I hear all that, completely agree with the importance of this. And so I'll make a motion to support the recommended position as is.
I'll second it.
Thank you. With the motion in a second, moderator, can you please open the lines for public comment?
This is the moderator opening up the Q&A. The instructions are on the screen for your reference. If you would like to participate, click that question mark inside of the square, type comment, send to all panelists, or raise your hand from your phone by pressing *3. Keith Yoshizuka, I will send a request to unmute your microphone.
Thank you very much. It took a while for it to show up. Keith Yoshizuka, California Society of Health System Pharmacists. I applaud the discussion about increasing the scope to all opioid antagonists. But as the motion stands before the committee, we speak in support of this bill, AB 1060. Thank you very much.
This is the moderator. No further requests. Would you like me to close the Q&A?
Yes, please. With motion on the floor and public comment received, if there aren't any additional comments, I'll take a roll call vote. Jose de la Paz?
Yes.
Thank you. Trevor Chandler?
Yes.
Thank you. KK Jha?
Yes.
Thank you. Maria Serpa?
Yes.
Thank you. Nicole Tebow?
Yes.
Thank you. And I vote yes, the motion passes. Members, Assembly Bill 1286 is the board's patient medication safety bill. The measure was considered in Assembly Business and Professions Committee yesterday and passed out of committee. It is my understanding that amendments were made to further define the conditions under which a pharmacy may close, to state that it may be closed if, based on the professional judgment of the PIC or pharmacist as specified, determine that conditions present an immediate risk to the health and safety of patients, personnel, or pharmacy staff. Amendments would further specify that the pharmacy shall reopen as soon as reasonably possible upon abatement of the issue. Another amendment relates to the staffing floor being established in the measure. As amended, there would be explicit language that provides authority for a pharmacist on duty to waive the requirement for additional staff. As a member of the Medication Error Reduction and Workforce Committee, I'm excited to see the board's measure moving forward. The provisions in this measure have the potential to significantly reduce medication errors and improve patient care. Members, as this measure is board sponsored, no action is necessary, but I do welcome your comments.
So I like to add that I like the provision of providing a floor of staffing. Just pardon my voice. I'm going through my third flu of this season. I don't know why. I like the floor of staffing that is the bill is proposing, which is a good thing. Providing a designated lunch hour when no other measures are available, that is also a good thing. But I have a couple of concerns regarding closing of a pharmacy as deemed by the pharmacist, especially in the rural areas where that may be the only pharmacy available. And pharmacists at their discretion can prioritize their work always and do what is safe. But I just don't feel that it'll be a good service to public if we allow pharmacies to close, especially in the rural area where availability of pharmacy or density of the pharmacy is very low. So that's my only concern. Thank you.
Great. Thank you, KK. I think the amendment as is actually does provide me at least with some reassurance that there are specific conditions in which it could occur. For example, if you are in a rural area and you have wildfires, I do strongly believe that those pharmacy personnel shouldn't be forced to go to work and fear losing their job if they don't, or that the pharmacist feels they have to maintain it open. But any other member comments?
Hi, Jesse, it's Maria. Just to kind of explain, because I know we have quite a few new members on the committee. Board-sponsored legislation comes from the position taken by the full board. And so this committee really just monitors them and provides input. We don't take a position on our own bills. So she's we're getting information about the board sponsored bill. In the full board meeting, when we discuss this, it would be a great opportunity to bring up your concerns about the board's policy statements on this bill, because potentially the policy statement could be adjusted or the bill adjusted. But as the bill is written, it's based upon the Board of Pharmacy's policy statements from a previous board meeting. So I just wanted to make that more well known, because I think that almost everyone here is a newer board member. Thank you.
Great. Thank you so much, Maria. I appreciate that.
Yeah, I just want to say I'm incredibly excited about this legislation. I think obviously it has a full process to go through, but given the really massive upgrades to pharmacist and pharmacy regulation and pharmacist protection, just very excited for this bill to be carried. And I know was having a board-sponsored bill get carried through the legislature all the way to the end is a large task, but I'm excited at the opportunity that this is going to be one of them.
Thank you. There are no other member comments. Moderator, can you please open the line for public comments?
This is the moderator. The Q&A is now open. The instructions are on the screen. If you would like to participate, click that question mark, type comments, send to all panelists. Press *3 from your phone to raise your hand. I do have an individual identified as Rita Maria. I'm going to send a request to unmute your microphone.
Yes, thank you so much, board members. Just wanted to comment on the language in this bill discussing medication errors. That's requiring community pharmacies to report errors to the Board of Pharmacy. We're hoping that there can be an exemption language or a clause that does not apply to general acute care hospital pharmacies that may be licensed as a PHY, but are operating under the general acute care hospital licensure, which of course, as you know, CDPH requires hospitals to have stringent medication error reduction programs and various other medication reporting requirements internally and externally. Thank you.
This is the moderator, Lindsay Gillahorn. I'm going to send a request to unmute your microphone.
Hi, thank you. Lindsay Gillahorn with the California Community Pharmacy Coalition. I'll keep my comments brief. I think, as you all know, as noted in the committee report, we are respectfully opposed to AB 1286. Definitely committed to continuing to work with the author and the board and the legislature. Our primary concerns just center on two provisions of the bill: the authority for a pharmacist to close a pharmacy, and then the staffing floor. On the staffing floor, there are some pharmacies in California where they literally will not be able to meet this requirement, especially those in rural areas, and this will result in reduced hours and potentially an end to 24-hour pharmacies. So just want to note that. When the bill was heard yesterday in Assembly Business and Professions Committee, several legislators raised serious concerns with the bill, particularly the closure provisions. And because of that, the author did commit to work on that and address some of the concerns that were raised. So we just want to say we appreciate that. We'd like to work with the author and the board on solutions to the safety and workforce issues, like a staffing floor based on volume and perhaps strengthening the complaint process. Also want to note that we appreciate some of the other provisions of the bill, including the authorization for pharmacy technicians to administer vaccinations. But because of the closure provisions and the staffing floor provision, we must continue to oppose. But again, just want to say we're committed to working with the board, the author, and the legislature on this as it moves through the process. Thank you.
This is the moderator, M. Rivas. I'm going to send a request to unmute your microphone.
Hello, Michelle Rivas, California Pharmacists Association. We do have a supportive amended position on the bill. And first, I want to thank the board for your leadership in taking on this issue. We think this is overall a great piece of legislation. We think it will do wonders to increase patient safety in the community pharmacy and address some of the issues that we hear from our members about who work in some pharmacies around staffing issues. So again, we want to thank you first of all for your leadership in this issue. We are very supportive of your efforts. We do have a couple of issues that we're looking forward to working with staff in the author's office to address. I would consider them more technical, I guess, in one of which is around the we would like to make sure that pharmacists are provided the option of using any federally recognized patient safety organization for reporting purposes. We want to make sure that they have the ability to report these, and we aren't tied to one specific platform, which may cause some issues for pharmacies to be able to comply. But again, overall, we're supportive of the legislation and appreciate your leadership. Thank you.
My name is Gregory Curtis. I am a pharmacist and I specialize in servicing surgical clinics. I believe this is the right section. It was not mentioned earlier, but where there are some changes to the surgical clinic licensing. There's talk of adding a self-assessment to section 4192, which I'm fully in support of. My question has to do with section 4204, where there's the addition of adding the requirement of the consultant pharmacist to sign the renewal form for the surgical clinics. Pharmacist consultants are not employees, and so they're not present at these centers on a daily basis. They're there once at least every 12 weeks or every 3 months. And so having something where the pharmacist has to sign the renewal form could delay the renewal. And surgical clinics frequently have troubles getting those back in time to get the renewal processed in time. So I don't want to add anything that would delay the renewal process. And if we could find another way to have the pharmacist consultant do that certification, it is already required on the quarterly report anyways. So I wanted to bring that up. Unfortunately, I don't get to follow Board of Pharmacy movements that carefully, but I did see this coming, so I did want to address my concern in this. This is what I do full time, and I wouldn't be able to get back to each center when renewals come. Thank you very much.
Thank you.
This is the moderator. I'm going to send a request to mute John Grubb's microphone.
Pharmacy Officer for University of California Health. Wanted to second the comments made by an earlier commenter that we feel that the pharmacies that are operated by general acute care hospitals be exempted from the error reporting requirements, because we already have pretty rigorous processes in place to report and track those errors internally and to take actions to prevent recurrence of those errors. Thanks very much.
This is the moderator. There are no further requests. Would you like me to close the Q&A?
Yes, please. Okay, members, we don't have to do a motion on this one, so we'll move on to the next measure. I think we'll do a couple more before we take a break, if that's okay with everyone. So Assembly Bill 1341 would establish temporary authority for a pharmacist to furnish COVID-19 therapeutics until January 1st, 2025, under specified conditions. Pharmacists have been performing these functions under a waiver issued by the Department of Consumer Affairs, as well as provisions of the PrEP Act. This measure is being considered today as part of the Assembly Appropriations Committee. I agree with the staff recommendation to establish a support if amended position and offer the amendment to make the provisions permanent. Pharmacists have been safely providing COVID-19 therapeutics throughout the public safety emergency. Permanent authority appears appropriate. Members, I welcome your comments and would entertain a motion if you believe such is appropriate.
Hi, Jesse, it's Nicole. I'll make a motion to support if amended.
Great, thank you, Nicole.
And I'll second that.
Great, thank you, Jose. Moderator, can you open the lines for public comment?
This is the moderator. The Q&A is now open. The instructions are on the screen. If you would like to participate, click that question mark, type comment, send it to all panelists, or press *3 from your phone to raise your virtual hand. Keith Yochizuka, I'm going to send a request to unmute your microphone. Just a moment as I locate your, there you go. Request sent.
Thank you. Keith Yoshizuka, California Society of Health System Pharmacists. We speak in support of the bill, and I applaud the board for their insight to remove the sunset date on the legislation. Thank you very much.
This is the moderator. I'm going to send a request to unmute Lindsay Gullahorn's microphone. Give me just a moment. Request has been sent.
Thank you. Hi again, Lindsay Gullahorn with the California Community Pharmacy Coalition. I will speak more on this issue when the committee gets to SB 524, but want to note that we are in strong support of this bill. And when we get to SB 524, I think that would address the issue of permanent authorization for pharmacists to dispense COVID, but we are supportive of this bill. Thanks.
This is the moderator. There are no further requests. Would you like me to close the Q&A?
Yes, please. Members, with a motion on the floor and public comment received, I will take a roll call vote. Jose De La Paz?
Yes.
Thank you. Trevor Chandler?
Yes.
Thank you. KK Jha?
Yes.
Thank you. Maria Serpa?
Yes.
Thank you. Nicole Tebow?
Yes.
Thank you. And I vote yes, the motion passes. Members, Assembly Bill 1557 is also a board-sponsored measure. The measure will make permanent authority for a California licensed pharmacist to perform medication chart order reviews from a remote location within California on behalf of California licensed healthcare facilities licensed under Health and Safety Code Section 1250 under specified conditions. As amended, the measure also includes an urgency provision. The measure enjoys support from several organizations. Members, no action is required on this measure, but I will welcome your comments if you have any. Seeing no member comments, moderator, please open the lines for public comment.
This is the moderator. The Q&A is now open. The instructions are on the screen for your reference. Press that question mark, type comment, and send to all panelists, or press *3 to raise your virtual hand from your phone. Kicho Yuzuka, I'm going to send a request to unmute your microphone.
Keith Yoshizuka, California Society of Health System Pharmacists. We speak in support of Assembly Bill 1557. Thank you.
This is the moderator. No further requests. Would you like me to close the Q&A?
Yes, please. Thank you. So the last one we'll go over before we take a quick break is Assembly Bill 1619. This has actually become a 2-year bill. As such, unless members have any comments, I think we can move on to the next item. Are there any comments from members? Okay, thank you. So I think because the next one may have some quite a bit of comment on it, I think it may be a good time to take a break. Is everyone okay?
Chair Crowley,
sure.
Are you going to open up for public comment for AB 1619?
Thank you, Eileen. Moderator, can you please open the line for public comment?
This is the moderator. The Q&A is now open. Instructions are on the screen. If you would like to participate, click the question mark, type comment, send it to all panelists. No request. Would you like me to close the Q&A?
Yes, please. Thank you. So we'll take a quick break here. If we can come back at 10:10, come back at 10:10. Okay, I think, are we able to get started without KK or should we wait?
Chair Crowley, this is Eileen Smiley. You do have a quorum if you want to proceed without KK.
Okay, I think for the sake of time, I'll probably continue forward and hopefully he can tune in and be able to provide comments. So Senate Bill 339 would authorize a pharmacist to furnish up to a 90-day course of PrEP or beyond under specified conditions. It would require the board to adopt emergency regulations by July 1st, 2024. Further, it would require health plans and health insurers to cover PrEP and PEP, including medications furnished and tests ordered by pharmacists as specified. The bill addresses some of the challenges discussed during the Licensing Committee's recent post-implementation discussion on pharmacist-provided PrEP and PEP. Further, it updates the law to allow for flexibility in treatment by removing the specified type of PrEP authorized to be furnished. It also provides a mean by which a pharmacist can continue to provide care beyond the 90 days under specified conditions, including that a patient receives testing and follow-up care consistent with the CDC guidelines. The measure will be considered in Senate Health Committee hearing on April 26, 2023. Members, I agree with the staff recommendation to establish a support position. I note the measure appears to enjoy broad support from a number of organizations, but does have opposition from the American College of Obstetricians and Gynecologists and the California Medical Association. Members, I welcome your comments and would entertain a motion if you believe such action is appropriate.
Yes, I would like to strongly support this bill. There are real gaps in HIV, PEP, and PrEP right now, allowing the HIV/AIDS epidemic to continue, and every new infection that's out there is a failure on our part as a state and a society to not take as many preventative measures as possible. California quickly established ourselves as a leader in expanding PEP and PrEP access, and unfortunately, we've allowed other states to get beyond us. Washington and Colorado, among others, have now eclipsed California in our ability to provide HIV, PEP, and PrEP to the public. And so this is a key step to regaining our leadership as it relates to ending the HIV and AIDS epidemic, and I fully support it, and I urge my colleagues to do the same.
Great. Thank you, Trevor.
This is Nicole. I completely agree with Trevor. Access to PEP and PrEP is one of the cornerstones of the plan to end the epidemic, and we know there's huge inequities in terms of people who live in rural areas and communities of color. So anything that we can do to help close those gaps, I agree with, and I will go ahead and make the motion to take a support position.
Second.
Great. Thank you. Any additional member comments? Okay, moderator, please open the lines for public comment.
This is the moderator, and we are opening the WebEx Q&A feature to facilitate public comment. If you've got a comment on the motion, you can either press the question mark icon, type the word comment in the text box and click send, or you may push the hand icon to raise your hand, and our calling users can press *3 to raise their hand. We do have a couple of requests for comment. Our first is from Keith Yoshizuka. Keith, I'm sending you a request to unmute your microphone. You're unmuted.
Yoshizuka. Thank you. Keith Yoshizuka, California Society of Health System Pharmacists. We fully support this bill from Senator Wiener. It closes a lot of gaps and expands some of the shortcomings of the bill that was passed a couple of years ago, and we fully support it. Thank you very much.
And our next request for comment comes from M. Rivas. I'm going to send you a request to unmute.
Hello, Michelle Rivas, California Pharmacists Association. We're one of the sponsors of this legislation. I just want to thank the staff for their recommendation and the positive comments from the committee members, and we respectfully request your support. Thank you.
And our next request for comment is from Mark Johnston. Mark, I'm going to send you a request to unmute your microphone. You're unmuted. And Mark, we're not hearing your voice. And Mark, if you'd like to use the drop down next to your mute and unmute button, you may be able to use a different microphone. And the other option is to type your comment into the Q&A text box if you're unable to get your equipment working.
You hear me?
Now we can hear you, yes.
Thank you for the suggestion on the alternate microphone, which I didn't even know I had. Mark Johnston with CVS Health. Of course, this bill addresses many important issues that everybody should be in support of. However, there is the issue that I brought up many times of ordering. And while this does require healthcare insurers to reimburse pharmacists for ordering, that's the only spot where it mentions ordering, is where it requires the healthcare folks to reimburse us. It sure would be a lot cleaner if in F1 we had straight up authority to actually order the tests. All it says in F1 is that we should ensure that the tests are done, but it doesn't give us the ability to actually order the test straight up. What it says is the pharmacist ensures that the patient receives testing, which could be interpreted as ensures that in order to furnish these HIV drugs, that you work with a physician or a nurse practitioner, somebody who can order the testing. I strongly believe that in F1, the pharmacist should be able to order the testing, and just referring to it later in the bill when it comes to payment, I don't think is good enough. I would suggest a support, if amended. That key piece may very well keep pharmacies from being able to furnish HIV prophylaxis meds. Thank you very much.
And this is the moderator. I do not see any other requests for comment. Shall I close the Q&A feature?
Yes, please.
Thank you.
With a motion on the floor and public comment received, unless members have any additional comments, I will take a roll call vote. Jose De La Paz?
Yes.
Thank you. Trevor Chandler?
Yes.
Thank you. KK Jha?
Yes.
Thank you. Maria Serpa?
Yes.
Thank you. Nicole Tebow?
Yes.
Thank you. And I vote yes, the motion passes. Members, Senate Bill 345 would prohibit a board from suspending, revoking, or denying a license of a person based solely because the licensees provided legally protected activity as defined. Legally protected activities include the exercise of rights related to reproductive health services or gender-affirming healthcare services. I note that the staff is recommending the board remain neutral on this measure. I believe it is appropriate to continue to watch the measure, but I do not believe a position is appropriate at this time. Members, do you have any comments?
Hi, Jesse. This is Nicole. I would actually prefer that we support this measure because we're seeing a lot of things happening in other states around reproductive health and gender affirming care. And those things are really crucial for patient safety. There are huge issues around you know, patient safety for those who cannot get access to gender affirming care. So I think it would be really meaningful for our state to say, you know, we will not, for our board to say, we will not go after your license just for providing these things that really are important parts of healthcare. You know, gender dysphoria is very real and is very deadly. And I would hate for someone to not want to provide that care because they're afraid of repercussions coming to them.
Perfect. Thank you so much for those comments, Nicole. Any other member comments? Does anyone want to make a motion?
I'll make the motion, Jesse, to change to a support position.
Thank you, Nicole. Any second?
Second.
Great, thank you. Moderator, can you please open the lines for public comment?
Certainly, we're opening up the WebEx Q&A feature to facilitate public comment. If you'd like to comment on the motion, you can look for the question mark icon, type the word comment and click send, or tap the hand icon, or our calling users can press *3 to raise their hands. Our first request for comment is from Keith Yoshizuka. And Keith, I'm going to send you a request to unmute your microphone.
Thank you. Keith Yoshizuka, California Society of Health System Pharmacists. Our organization has taken a position of support if amended. We would like the profession of pharmacists to be added to those healthcare professionals who are protected from engaging in legally authorized activities under this bill. Thank you.
And our next request for comment comes from Stephen Gray. Stephen, I'm going to send you a request to unmute your microphone.
Thank you very much. First of all, I strongly support what Keith just verbalized in that pharmacists and pharmacies, though, also need to be protected. The Board of Pharmacy has a long-standing legal authority, position, and policy of automatically disciplining pharmacists and pharmacies that have California licenses if they are disciplined in their home state. It's automatic. And so I would not like a pharmacy, for an example, in another state to be disciplined, or a pharmacist disciplined, and then that also then automatically subjects that pharmacist or pharmacy to discipline in California of their California license or licenses. So I strongly support the motion and make sure that it covers both pharmacies and pharmacists. Thank you.
And I see no further requests for comment. Shall I close the Q&A feature?
Yes, please.
Thank you.
Members, do you have any additional comments after hearing public comment?
Hi, this is Nicole. I agree with the comments that it should specifically include pharmacists, and I liked Stephen's comment about pharmacies as well.
Great. Yeah, I agree with that. My only area of hesitation is I do believe that the board should be able to evaluate certain things. I want to make sure that there isn't you know, activities that maybe would be concerning. So I do want to make sure that we're not making it more difficult for healthcare providers to provide services, especially gender affirming care and reproductive health services. But I do get a little nervous if there is activity going on in other states that we would be completely prohibited from evaluating that and on the licensee. So that's where my hesitancy lies. But any other comments from members?
Sorry, I keep taking over this conversation, but yeah, I hate the idea that someone's going to be in a state that does not allow gender affirming care, their license is disciplined, and then we have to discipline their license when that isn't something that is problematic for us in this state. So I feel like this is really important to to take a stand on that we are going to, one, support our pharmacists in providing the care that is best and right for our patients.
Great, thank you, Nicole.
I second everything Nicole says. She said it better than
Thank you, Trevor.
Jesse, this is Anne. I apologize for interrupting. Can I just clarify one point, and council can hopefully jump on as well if I'm misstating things. So I think that one of the public comments suggested that the board automatically takes action based on discipline in another jurisdiction, and I just want to clarify that there is no automatic action that is taken. If a license is disciplined in another jurisdiction, there is no automatic action that happens in California. It could lead to discipline in California, but there is no provisions in the law, at least that I'm aware of, that it is automatic. It's done on a case-by-case basis. So I just wanted to clarify that, and hopefully Eileen can maybe confirm that if she's available.
This is Eileen Smiley, and Anne is absolutely correct. We don't have any automatic discipline that's ever imposed. If we proceed with discipline against the licensee that goes via an accusation, it would be subject to the Attorney General review and ultimately by the board. So there's nothing automatic about any of our disciplinary actions that this board will ever take.
Okay, thank you both. So if no one else has any comments, I'll do a roll call vote. So this is to establish a support position for SB 345. Jose De La Paz?
Yes.
Thank you. Trevor Chandler?
Yes.
Thank you. KK Ja?
Yes.
Thank you. Maria Serpa?
Yes.
Thank you. Nicole Tebow?
Yes.
Thank you. And I vote yes. The motion passes. Thank you. Members, Senate Bill 427 would prohibit prior authorization or step therapy for medications approved for the prevention of AIDS and HIV under specified conditions. The measure would allow for prior authorization or step therapy if at least one therapeutically equivalent version is covered without prior authorization or step therapy. I'm comfortable with the staff recommendation to establish a support if amended position. I agree with the policy goal of the measure, but do not believe it goes far enough. I believe the requirement should be extended to include more than a single therapeutic. Members, I welcome your comments and would entertain a motion if you believe such is appropriate.
I move to endorse the support if amended recommended position.
Thank you, Trevor.
This is Nicole. I'll second.
Great, thank you, Nicole. Moderator, can you please open the lines for public comment?
Certainly, and we've opened up the WebEx Q&A feature as a means of offering public comment. If anyone has a comment on the motion, you can look for the question mark icon, click that, type the word comment and send. If you'd like to raise your hand, you may also do that by clicking once on the hand icon, and our call-in users can press *3 to raise their hands. Are there any comments on this motion? I do not see any requests for comment. Shall I close the Q&A feature?
Yes, please. Thank you.
You're welcome.
Members, with a motion on the floor and no public comment received, unless members have any additional comments, I'll take a roll call vote. Jose De La Paz?
Yes.
Thank you. Trevor Chandler?
Yes.
Thank you. KK Ja? KK, are you there?
Sorry, I was unable to unmute myself. Yes.
Great. Thank you, KK. Maria Serpa?
Yes.
Thank you. Nicole Tebow?
Yes.
Thank you. And I vote yes. The motion passes. Members, as amended, Senate Bill 524 would establish authority for a pharmacist until January 1st, 2034 to furnish specified medications based upon test results received for specified illnesses, conditions, or diseases. Specified illnesses include SARS-CoV-2, influenza, streptococcal pharyngitis, sexually transmitted infection, and conjunctivitis. It would require the board to develop standardized procedures and protocols with the Medical Board of California. It would also require a pharmacy or healthcare facility in which a pharmacist is providing such treatment to provide an area designated to maintain privacy and confidentiality. This would also require documentation to the extent possible of the testing services provided in a record system maintained by the pharmacy. The measure would specify the provisions established are covered under Medi-Cal. Members, I agree with the comments. I believe patients would be well served by pharmacists performing these services, but I am extremely concerned with the current working conditions in community pharmacies and specifically chain settings. Just to kind of set the picture. So I think we've talked quite a bit in several meetings about how test to treat really does go hand in hand. And if you are already testing a patient, it makes sense to provide them the treatment. And I absolutely agree with that. I'm just thinking as a patient, if I go into the pharmacy, I fill out this form, pharmacist has to evaluate it, I go through the process of being tested, and then I have to wait for my results. So maybe 15, 20 minutes, sometimes longer. And then if my results come back positive, the pharmacist has to evaluate that. They decide what medication or therapeutic is appropriate. And then I have to wait again for the actual treatment. Meanwhile, the pharmacist has been coming in and out of workflow, sometimes as the only person there. And their work is not only accumulating, but they're multitasking all at the same time. That's concerning for me as just from a patient safety standpoint. And until I think those conditions are addressed, I'm hesitant on this bill as it is. But I believe the proposed authorizations covered in this measure are appropriate and consistent with pharmacist knowledge, our skills, and our abilities. I'm just not confident in the community chain settings currently having appropriate staff to support these services and whether that's in the best interest of our patients while also balancing all of the other workloads we have. So members, I note that staff are not recommending a position. While the policy in this measure should not be a complex one, the practical realities right now of working conditions make it difficult to establish a support position. I believe if the provisions in AB 1286 were already in place, this would be an easy measure to support. The measure was heard in Senate Business, Professions, and Economic Development Committee on April 17th. The measure passed and will be heard in Senate Health Committee on April 25th. The measure has several entities supporting the measure, including the California Pharmacists Association. The measure is sponsored by California Community Pharmacists Coalition, which is a project of the California Retailers Association. There are several city governments that are supportive of the measure. I note there is opposition to this measure as well, which includes from the California Medical Association and UFCW. Members, I welcome your comments on this measure.
Jessica, this is KK. I welcome the expansion of duties that pharmacists can provide. I think it's as we all know, most easily accessible healthcare provider out there, and the reach of pharmacists is far and wide, especially in the rural communities, one in which I live. So I welcome this. Your concerns about staffing and whatnot is absolutely valid, but I think there are different measures to enforce that, and that, in my opinion, should not limit the extent of service that our profession can provide. So that's my comments. Thank you.
Thank you, KK.
Yeah, Jesse, I agree with and I identify myself with your statements as well. The overwhelming issue facing pharmacists that also significantly impacts quality of care for consumers is the overstaffing or understaffing and overworking currently of our pharmacists. And so I'm actually more inclined to take an opposed unless amended stance on this to make sure that we're making clear that we need to address staffing first before adding more and more responsibilities and more pieces to put on the pharmacist. And so that's where I'm thinking right now.
Great, thank you, Trevor.
Hi, this is Maria. I think I just kind of wanted to explain my thoughts about the difference between support if amended and oppose if amended, because they're really not the same, and imply to legislators and to the public what the board's position is. And so if we feel very strongly that you are willing to oppose this if they don't change it, then oppose if amended. But if we think that that at some time we will support it and we want to give the word out that we are supportive, but we request changes, and it would be support if amended. Oppose if amended can often carry a big stick behind it. And so I'd be a little worrisome about going there.
Thank you, Maria, for that. Do you have any thoughts about a position that you'd be interested in supporting, or just comments about everything else that was said?
It's difficult because I think, you know, intellectually and theoretically we have positions, but we also have to consider is what the legal ramifications of our positions are too. Because I have personal opinions and I agree with what everyone stated, and you know, it's like I'd like to make it the best that it could be for everyone. And how do we get there is the challenge, you know, and that's part of the discussion that we have, and we use our positions to help jockey the final result. You know, so I know that the staff requested none, and none may not necessarily be the best one, because we certainly want to be at the table and have a strong opinion. So I have no real strong opinions. I think the discussion here is sounding like we want to do some sort of support if amended, but that's, I'm just picking that up from what people are saying here. I'd be interested to see what the public said, and maybe we can rediscuss it.
Okay, thank you.
Jesse, understanding the nature of support if amended and oppose if amended, and knowing that the biggest implication for this is regarding the access to consumers, to making sure that they're getting quality care from their pharmacist, I'm going to move that we take a oppose unless amended position.
Okay, thank you, Trevor. Does anyone want to second that motion?
Hi, this is Eileen Smiley, and Member Chandler, is the amendment that you would want would be to address the staffing issues within the pharmacy, just so it's clear?
Yes.
Just so I'm clear, Trevor, are you proposing that X set of staffing conditions must met before Y set of duties performed by the pharmacist? Is something along those lines is what you're thinking?
Along those lines, yes.
Okay, thank you.
This is Nicole. I'm wondering if, because 1286 is already potentially going to address some of this, I'm wondering if it's more of a watch or a wait kind of a situation to see what happens with that, as opposed to putting similar amendments into this one as well. What are people's thoughts?
I think I'm thinking along your lines, Nicole, that it's sequential, that let's establish a floor, and then I'm 100% agreeing about expanding the services, things that pharmacists can do, and really don't want to get that opportunity wasted. That if we are trying to expand, especially for pharmacists who are really could be the only provider in that area. So I think that sequential approach may not be a bad idea, but I would open to hear what other members say and also the public comments.
I lean more to what Nicole is saying. This is Maria, because we're not required to take positions, hard positions right away. We can always add a position pretty quickly. The chair can add a position pretty quickly with the president and with staff. There are ways to do that. They don't have to wait to another meeting. I'm just really concerned of us going on the record as opposing expanding patient access and pharmacy services. that oppose really strikes me hard. Because would we just, if we didn't get the changes, we would have to oppose this legislation. I don't think that board wants to go on record as opposing expanding care.
Great. Thank you all. I'm also pretty torn. I think a lot of us feel similarly. I probably agree that something watching it may be appropriate because unfortunately we can't rely on AB 1286 because it hasn't been passed yet. We don't know what's going to happen to that legislation. So I'm torn as to whether we request specific language and staffing in this or if we just watch. But if anyone, did we end up having a second on Trevor's motion?
No, I'm fine letting it die if there's no second.
Okay. Does anyone want to make a different motion?
I'm a little stuck. I can't tell if I should do support if amended and say just that we add a line about with appropriate staffing, or if it's a watch based on.
I would lean towards watch, being closer to the position of what the staff recommended. The staff recommends none. And so, watch is a little bit more stronger than that without jumping to an official position.
Okay.
And keeping in mind that we can always get a position quickly. It's not that we need to have a position now urgently. So I guess, but I'm also very cautious when it comes to legislation. So.
Okay, I like
staffing. Go ahead, Nicole.
I was going to say, I like your point, Maria. I'm going to formally propose that we take a watch position.
Yeah, what I was going to say is that, staffing being the necessary condition, not necessarily sufficient condition, we should watch it. And then I would also like to unburden this one from the staffing requirements, because that's two separate things. That, yeah, staffing is something we need to have, that's desirable, but expansion of duties or providing more services is of more importance. And how we're going to do that, that's also important, but a different step altogether. So I'll support watch.
Thank you. So is that, I think I heard a motion from Nicole then, and is that a second from you, KK?
Sure, we can do that.
Sure, perfect. So if there are no additional member comments, I'll have the moderator open the lines for public comment.
And this is the moderator, and we've opened up the WebEx Q&A to facilitate public comment. If you'd like to make a comment, you can click on the question mark, type the word comment and click send, or raise your hand by clicking once on the hand icon, and call-in users can press *3 to raise their hand. And we do have some requests to comment. The first is Lindsay Gallahorn. Lindsay, I'm going to send you a request to unmute your microphone. And again, each person has 3 minutes to speak. You're unmuted.
Thank you. Hi, Lindsay Gallahorn with the California Community Pharmacy Coalition. We are the sponsors of SB 524, proud to support it. Appreciate the discussion on this today. Our coalition and the author and supporters view this as a healthcare access measure, given that millions of Californians, I think the latest number I saw was 8 million Californians live in areas of the state that are designated as healthcare professional shortage areas with a lack of available primary care providers, especially in rural areas. On the other hand, as you all know, the vast majority of Californians live within just a few miles of a community pharmacy and receive a number of healthcare services from pharmacists in addition to their medications. And this bill applies to all pharmacists, not just community pharmacies. Unfortunately, when a patient has symptoms for conditions like the flu or strep, they have to wait to see their primary care provider to receive treatment, even though their pharmacist can test for these conditions. And for a lot of people, getting an appointment can take days or even longer. And if symptoms develop in the evening, on the weekend, patients face even longer to receive treatment for some of these more simple conditions, or they visit urgent care, potentially wait hours to get the care they need. So we think this is a practical measure that will give patients the option to go to their local pharmacy to receive both testing and treatment for just 5 conditions. We did narrow the bill significantly from when it was initially introduced. As introduced, back in March, it would have allowed pharmacists to do treatment for all CLIA-waived tests, recognizing that for pharmacists, there isn't even treatment for all of those tests. We narrowed it to just 5 conditions: COVID, flu, strep, pink eye, and sexually transmitted infections. We have been working with some of the opposition who have concerns, trying to address those concerns. We added in privacy requirements to the bill so a patient has privacy when they're getting treatment, added in the statewide protocol for training. And we're certainly willing to talk about the staffing issues. I don't see pharmacies where there is not enough resources providing this. This is not a mandate, it's an option. But certainly hear your concerns, and happy to and willing to work with the board on any concerns that you have. We hope eventually you can come to a support position. Thank you.
Graywell with UFCW Western States Council. UFCW has an oppose unless amended position on a Senate Bill 524. We do not disagree with the overarching goal of providing additional access to healthcare services, knowing that our member pharmacists are best equipped to deliver those services, but our concerns lie squarely in the fact that pharmacists currently do not have adequate staffing to complete even their current workload. And they also don't have the autonomy over workflow decisions. We believe that patients, especially in rural communities, deserve good access to care. And often these services will require not just 15 minutes to wait for a test result, but time to consult the patient, time to learn about the patient's medical history, to develop the best treatment plan, answer questions on behalf of the patient. And those all take time, extensive time and resources on behalf of the pharmacist. And so if a pharmacist is constantly breaking workflow and don't even have time currently to provide adequate patient consultations, what's to say that they're going to have time in their current workload to be able to do all those steps to provide the most appropriate and adequate patient care? That's why UFCW proposes the following amendment, which is that in order to be able to provide the clinical services authorized by this proposal, that there be an additional pharmacist in the pharmacy to provide only those clinical services. This ensures that pharmacists who are overworked and understaffed on their current workload duties do not need to break workflow to assist patients and offer treatment on the illnesses and conditions, which are time extensive, like I mentioned. This amendment will ensure that pharmacies can provide the highest level of patient care and services delivered by pharmacists whose sole focus will be testing and treating illnesses and conditions provided under this bill. We do not think it's unreasonable to ask for additional staff when you are talking about such a large expansion of a pharmacist's duty, and think it's something that should be required when we talk about additional duties that are placed on our pharmacists. I will leave my comments there, but really appreciate the time and ability to make public comment.
Thank you. And our next request for comment comes from Keith Yoshizuka. Keith, I'm going to send you a request to unmute your microphone. And you're unmuted.
Yoshizuka, California Society of Health System Pharmacists. We were on record as supporting this this bill. I understand that it was amended to resolve some of the opposition. It used to be 10 years ago, Senator Hernandez SB 493 dramatically increased access to health care, and California led the country. That was 10 years ago. And during those 10 years, other states have surpassed California in providing access, particularly in the area of test and treat. So I'm hopeful that we can proceed with this legislation. I understand concerns about workload, but keep in mind, SB 493 expanded the authorities of the pharmacist, and quite a few of those authorities that were granted to pharmacists have not been incorporated into the offerings of many of the large chain pharmacies. So just because, you know, as was pointed out by members of the board earlier, it does not mandate. It the services be provided. But it gives authority if the pharmacy wishes to have these services available to the public. And those that really want to engage in the community are going to do so. Thank you very much.
And our next request for comment comes from Stephen Gray. Stephen, I'm going to send you a request to unmute your microphone. You'll have 3 minutes. And Stephen, did you get there you go.
Thank you. I also would like to support what Keith just brought up, which is that it has been 10 years since SB 493, and indeed other states have moved forward with test and treat. California needs to move forward. I believe that the actions that the board has taken to resolve staffing with the other bill go a long way to address the staffing issues, and there are other things that will address the staffing issues. Although I am completely sympathetic to the fact that some pharmacists are put in situations where they cannot comfortably or even as a practical matter meet all of their duties. One of the things I'm concerned about this bill continue to move in the wrong direction is that it would require that the Board of Pharmacy have a standardized procedure and protocol that has to be agreed to by the Medical Board of California. I believe that with the adoption of AB 1533, we're past having to get permission from the medical board or the medical association for everything we need to do to support the care of our patients. And I would recommend that the consideration be given to take that out of the bill. The bill already requires that the pharmacist would have to use, quote, the most recent relevant and appropriate evidence-based clinical guidelines, et cetera. And in fact, we already know that when we adopt standardized procedures with the medical board or otherwise, that it actually interferes sometimes with updating of what should be done and causes a lot of confusion. Likewise, there's confusion with continuing to have these standardized procedures and protocols adopted by with the medical board or otherwise, and how that interacts with a board, with a pharmacist's ability to do collaborative practice agreements, which all pharmacists now can have collaborative practice agreements, or with the conditions in which the advanced practice licensed pharmacists can provide these clinical services also. So I would suggest that we move away from having to adopt standardized procedures and protocols, especially if it has to include approval by the medical board. Thank you very much.
And our next request for comment comes from Mark Johnston. Mark, I'm going to send you a request to unmute your microphone.
Thank you, Mark Johnston with CBS Health. I agree with what Keith just said. California has been a leader for more than a decade in advanced pharmacist practice. The California board has traditionally recognized that pharmacists need to evolve as a profession and divorce themselves from simply dispensing a product and get reimbursed for the cognitive services that we as doctors of pharmacy have adequately been trained for in college. These include smoking cessation, hormonal birth control, and the HIV prophylaxis furnishing that you just overwhelmingly supported without these exact same concerns. This bill would increase access to care. It would decrease cost to Californians for that care. And I am simply baffled as to why this new board would not continue the great work that the California board has done for more than a decade in expanding pharmacist practice. Thank you.
And our next request for comment comes from M. Rivas. I'm going to send you a request to unmute your microphone.
Hello, Michelle Rivas, California Pharmacists Association. CPHA is in support of SB 524. Again, we agree with the premise of this legislation, which is to increase access to care, especially in underserved communities. And we certainly do understand some of the issues raised today about staffing in certain pharmacies. But again, we think the overriding issue here is increasing access points. And pharmacists, as you all know, were already granted the authority to conduct these CLIA waive tests. So we think the next reasonable step is to also allow pharmacists to provide the medication, especially for those patients who have a difficult time getting to see a prescriber. In other settings, we know that community pharmacies are far more accessible than any medical offices are. So again, we see this as a significant ability to increase access points for patients who have a difficult time getting in to see a prescriber. And we're hopeful that and I'm feeling very optimistic about your sponsor bill, AB 1286, because it's a great piece of legislation. And there are a lot of protections in that bill. So we're confident that your legislation will address any concerns later about staffing issues. Thank you for your time.
And we do have one more comment from call-in user 9. I'm going to send you a request to unmute your microphone. You can press *6 to unmute. And call-in user 9, I believe there you are, you're unmuted. You can go ahead. I'm afraid we're not hearing your voice. Oh.
Hi, can you hear me?
Yes, now we can hear you.
Hey, I'm a retail pharmacist. I agree with everything said about us pharmacists being able to do that and at the same time being overworked and understaffed. Just one thing that I wanted to add is some patients do multi-pharmacies and we don't see the whole profile. Unlike doctors who have lab work, they know kidney status, liver, all that information that we're going to be lacking. So we just need to do or have that amended where the patient has to give us like more information about their clinical health.
All right, thank you. And there are no further requests for comment. Shall I close the Q&A feature?
Yes, please.
Thank you.
We've received a lot of public comment. I'm going to open it up for members to make any additional comments.
Jessica, this is KK again. If Anne can give a little bit more color, or Eileen, on our watch position, does that continue to support what is here? Because it's overwhelmingly what I believe is everybody who were in favor of watch were okay with it as is, but may want to address staffing and whatnot. I was of opinion that staffing is a separate issue enforcement wise, and this is more of an expansion of duty, so we should go ahead. But if Anne or Eileen can clarify what watch position would be.
This is Eileen Smiley. I may defer to Anne about what we generally do, but generally when we establish a watch position, what I would call reading at times is we'll communicate with the author's office why we're watching it, and if there's any concern, but I'm going to defer that to Anne because she's the one who usually drafts all the different letters to the different authors.
Hi, this is Anne. I'm sorry, I lost my audio connection for a moment, so I apologize for my delay in responding. Can you hear me now?
Yes.
Okay, thank you. Yeah, so I only heard part of what Eileen was saying. So typically the watch position It acknowledges that we're aware of it. We can communicate as part of our position that the board, notes support of the policy, but recognizes the challenges in the marketplace, and as such is continuing to watch it while we are reviewing the other other measures that could potentially impact whether or not the board could ultimately move to a support position and articulate some of those things. So I believe that that's an approach that the board has, taken in the past, where you're kind of laying out, where the board is in terms of the policy and the challenges, and explaining that that's why the watch position, if that's helpful information.
Thank you. And yes, it is. Thank you.
Perfect. Were there any other member comments? Okay, I do have a couple notes just from the public comment. I understand this doesn't mandate any pharmacist to be required to provide these services, but as we've said and noted in several meetings, there are several employers that will mandate all of their pharmacists provide these services, which is part of the reason for the hesitancy. And I do want to acknowledge and appreciate the sponsors of the bill for being adapting the language requiring the state protocol in the privacy area. And ultimately, I think access is absolutely our goal for patients. I want to be sure that we're providing quality care, access to quality care, and not just access for the sake of access. So if there's no other member comments, I think we can take a roll call on the vote. Right now, the motion on the floor is to have a watch position. Jose de la Paz.
Yes.
Thank you. Trevor Chandler.
Yes.
Thank you. KK Jha.
Yes.
Thank you. Maria Serpa.
Yes.
Thank you. Nicole Tebow.
Yes.
Thank you. And I vote yes, the motion passes. Members, Senate Bill 544 would create permanent authority for remote board meetings under specified conditions. The measure will be heard in the Senate Judiciary Committee April 25th. I agree with the staff position to support this measure. Members, I welcome your comments and would entertain a motion if you believe such action is appropriate.
Hi, Jesse. It's Nicole. I wanted to say that I strongly support this and think we should. I think one thing that hasn't been talked about a lot with this bill is the equity that it provides. I'm someone who has limited mobility, and being able to do all of our meetings remotely has been hugely helpful for me. And when we do have to go in person, that provides a barrier. And I think this applies to a lot of people for a whole variety of reasons, from disability to caregiving, to being neurodivergent, a whole host of reasons. So I think for that reason alone, we should support it, beyond just the convenience for everyone who is able-bodied.
Perfect. Thank you so much for sharing that, Nicole. You make a really good point. Does anyone want to make a motion to support this?
And
or
I'm
any other
sorry,
motion?
I will make the motion as well. I meant to do that.
Great. Thank you, Nicole.
Second.
Thank you, Trevor. Moderator, please open the lines for public comment.
Certainly. We are opening up the WebEx Q&A feature to facilitate public comment. If you'd like to make a comment on this motion or the bill, you can look for the question mark icon, type the word comment and click send, or our calling users can press *3 to raise their hand. Everyone else can look for the hand icon and click that. Are there any comments on this bill? I do not see any requests for comment. Shall I close the Q&A feature?
Yes, please.
Thank you.
And if there are no additional member comments, I'll take a roll call vote. Jose de la Paz, how do you vote?
Yes.
Thank you. Trevor Chandler?
Yes.
Thank you. KK Jha?
Yes.
Thank you. Maria Serpa?
Yes.
Thank you, Nicole Tebow.
Yes.
Thank you, and I vote yes. The motion passes. Members, Senate Bill 826 would establish a process for the board to receive subsequent arrest notifications from the FBI. I agree with the comments included in the meeting materials, including acknowledging the inequities that exist in the criminal justice system. However, given the board's consumer protection mandate, I believe a support position is appropriate. Members, I welcome your comments and would entertain a motion if you believe it's appropriate.
I move to accept the recommended position of support.
Great, thank you, Trevor. Does anyone want to second the motion?
I'll second it. This is Maria.
Thank you, Maria. Moderator, can you please open the lines for public comment?
Of course, and we are opening up the WebEx Q&A feature to facilitate public comment. If anyone has a comment on the motion or this bill, you may look for the question mark icon, type the word comment and click send, or raising your hand by clicking once on the hand icon, and call-in users can press *3 to raise their hand. Any comments on the motion? I do not see any request for comment. Shall I close the public comment feature?
Yes, please.
Thank you.
So if there are no additional comments from members, I'll take a roll call vote. Jose, how do you vote?
I vote yes.
Thank you. Trevor?
Yes.
Thank you. KK?
Yes.
Thank you. Maria?
Yes.
Thank you. Nicole?
Yes.
Thank you. And I vote yes. The motion passes. Senate Bill 873 would require the cost-sharing savings of a prescription drug based on rebates received to be calculated at the point of sale as specified by requiring the healthcare service plan or insurer to provide the information to the dispensing pharmacy. The measure is being considered today as part of the Senate Health Committee hearing. I agree with the policy goal of the measure and the staff recommendation of a support position. Members, I welcome your comments and would entertain a motion if you believe it's appropriate.
Hi, Jesse. This is Nicole. I love the concept of this, but when I'm thinking about it in practical terms, I think it's missing some protections for pharmacy. I worry that if the PBMs have to pass along these rebates, they're just going to turn around and claw back more money from pharmacies for whatever reason. So I really think there should be some kind of an amendment to this that puts the burden of coming up with these rebates very squarely onto the PBMs, and that nothing will fall to the pharmacy. If, say, the PBM fails to do it at the point of sale, they can't turn around and take money back from the pharmacy, or say that the pharmacy owes the patient money or something like that. So I think there needs to be a little bit more added to this to make sure it doesn't overly burden either administratively or financially pharmacies.
Thank you, Nicole. That's a really good call out. Did you want to make a motion on that of support?
I don't know why I can't remember to say that. Yes, I would propose that we support if amended.
Okay, thank you.
I'll second.
Thank you, Trevor. Any other member comments? Okay. Moderator, can you please open the lines for public comment?
Certainly, and we've opened up the WebEx Q&A feature to facilitate public comment. If anyone has a comment on the motion or the bill, you can look for the question mark icon, click that, type the word comment and click send, or you may raise your hand by clicking on the hand icon, and our calling users can press *3 to raise their hand, and instructions are on the screen. Are there any comments on the motion or the bill? I do not see any requests for comment. Shall I close? Oh, one moment. We do have a request for comment from Rita Maria. I'm going to send you a request to unmute. You're
Just
unmuted.
wanted to echo Board Member Nicole's comments. We think that the bill is just unclear as how this is going to work at a point of sale. And from a pharmacy perspective, we do have concerns as far as how this would be operationalized, and we would not want to take responsibility. So I do agree with Nicole's comments. Thank you.
And I do not see any other requests for comment. Shall I close the public comment feature?
Yes, please.
Thank you.
So with the motion on the floor and public comment received, if there are no additional member comments, I'll take a roll call vote. Jose, how do you vote?
I vote yes.
Thank you. Trevor, how do you vote?
Yes.
Thank you. KK?
Yes.
Thank you. Maria?
Yes.
Thank you. Nicole?
Yes.
Thank you. And I vote yes. The motion passes. So members, the next item is the regulations portions. The remaining items are for information only. As detailed in the meeting materials and associated attachments, the board has several regulations in various stages of promulgation. I do not intend to review each as the information is contained in the public materials. I note that the board currently has 4 regulations undergoing pre-notice review by the Department of Consumer Affairs or Business Consumer Services and Housing Agency. Additionally, staff are reviewing the comments provided by DCA related to the board's proposed changes to its disciplinary guidelines. Staff are also working on drafting regulation documents for 5 regulation packages, including 1 regulation package to update self-assessment forms via the Section 100 process. Members, do you have any questions or comments on the regulations? Hearing none, moderator, please open the lines for public comment.
Certainly, we are opening up the WebEx Q&A feature as a way to facilitate public comment. If anyone would like to make a public comment, you can look for the question mark icon, type the word comment in that text box and click send, or you can raise your hand by clicking once on the hand icon, and our calling users can press *3 to raise their hands. Are there any public comments? I do not see any requests for comment. Shall I close the public comment feature?
Yes, please.
Thank you.
Members, before we adjourn today, I would like to thank everyone for your time and participation. Our next meeting will be July 18th and will be held in person with the opportunity for stakeholders to participate via WebEx. Thank you, everyone.